Welcome to Module 1 of the Tobacco-Free Futures Implementation Series, Introduction and Initial Planning. Tobacco-Free Futures is an integrated health systems tobacco cessation model developed for Alberta Health Services to provide support for Albertans who use tobacco products. Tobacco use is the leading preventable cause of disease, disability, and death in Alberta. In 2002, the direct healthcare costs of treating tobacco-related illness in this province were estimated to be $470.6 million per year. Tobacco users are at a higher risk of hospitalization and have longer stays than the non-smoking population. Tobacco use is an important vital sign in assessing someone's health. Tobacco is responsible for 30% of all cancer-related deaths in Alberta. Although we now have more former than current tobacco users in Alberta, we still have communities and populations where tobacco use remains between 40 to 70%, well above the provincial average of 17.4%.
The human, social, and economic costs of tobacco use in Alberta are enormous. Every year, over 3,000 people die from tobacco-related illness, and many more suffer ongoing consequences of those illnesses. So we need to do our best to ensure that we work to reduce the number of those illnesses, prevent illnesses from happening, and ensure that our health system is oriented toward doing that. It'll take some time to ensure that our system is oriented toward ensuring that all people who appear at any of our programs or facilities are identified as tobacco users and ensuring that they do receive the appropriate treatment. Implementing the tobacco-free futures will require support from, of course, our leaders as well as from all of the staff that work within AHS. It is important to understand that by implementing tobacco-free futures, we will have appropriate standards of care and standards of practice. At Alberta Health Services, we are committed to improving the health of the population, and tobacco-free futures is a key ingredient in moving forward on that direction.
For myself as a healthcare professional, the impact or burden of disease caused by tobacco is something that I was exposed to very early on in my training, and I've continued to experience throughout my career as a healthcare professional, but also in my personal life. It's telling when you have to bury a childhood friend who became addicted to tobacco as an 8-year-old and who died of brain cancer before 40 years of age. When you look at that and you say in terms of over the 30 plus years that that individual had their tobacco dependency, how many opportunities were missed when they interacted with the healthcare system to discuss their dependency. All too often as healthcare professionals, we are not aware of the knowledge and tools that are out there to allow us to deal more effectively with tobacco dependency in our patients and clients. Furthermore, as a healthcare system, you have somebody that's coming into a healthcare facility or program, they're using tobacco, and yet we're not asking them as they come in whether or not they use tobacco. It's a vital sign. It would be unacceptable in terms of as healthcare professionals if we were admitting and caring for a patient without us taking their blood pressure and heart rate. So how is it acceptable for us not to document whether or not they are using tobacco? And given our AHS's policy for tobacco and smoke-free places, inquiring whether or not they want support to manage their nicotine withdrawal symptoms. With tobacco-free futures guidelines, we're talking about implementing across Alberta Health Services a standard approach of brief intervention based on best available evidence. And that approach is called the 5 A's.
The 5 A's approach is to ask every patient who presents to the facility if they use tobacco, advise all tobacco users to quit, Assess the user's readiness to quit and interest in withdrawal support. Assist by identifying, profiling, and documenting both pharmacotherapy and behavioral support, and arrange follow-up support and ongoing pharmacotherapy.
The evidence is quite clear that often people who use tobacco may make 7 or 8 quit attempts before being successful. So that's why it's important to ask each time the person's status is whether or not they're using tobacco. You know, if they've stopped using tobacco, it's an opportunity to reinforce their success with their previous quit attempt. If not, then it's a chance to encourage them to try again.
The Tobacco-Free Futures Guidelines provide a roadmap and standardized resources that can guide your site in adopting tobacco treatment as a standard of care. Tobacco intervention can range from brief intervention, the 5 A's you just saw, to a more intensive treatment and can be delivered across the continuum of care. 4 phases of implementation have been identified. It's not necessary for these phases and their associated processes to be completed in a linear fashion or in isolation. They are all interrelated and may often overlap with another during the implementation timeline. We're going to start with Phase 1, initial planning, and then work our way through the other 3 phases in further modules. A 5th module will discuss considerations for implementation in specific care settings and with specific populations.
It's a good idea, and when people hear the idea, how the program works, it kind of resonates with them. So it's not really a matter that we had to sell people on the idea. It was more a matter of explaining what the program was about, essentially how simple it was, how low-key it is, yet offers people who do smoke and are admitted to hospital the opportunity to use smoking cessation aids or nicotine replacement therapy during the course of their admission, and offers also a low-key approach, asking them if they've ever considered quitting. So between those 2 things, I think it's fairly easy to understand how beneficial that could be to patients.
The initial planning phase is outlined in chapters 3 to 6 of the Tobacco-Free Futures Guidelines. This phase involves the formative processes to set the stage for implementation, including engaging leadership, forming a steering committee, completing a tobacco and smoke-free environments policy compliance assessment, and setting timeline for implementation of the initiative. One of the most important things in accomplishing these changes is leadership support. Key stakeholders need to be engaged from the beginning, and all levels of AHS staff need to be involved from the ground up. Showing how this initiative supports AHS goals is an important first step in gaining support. For more information on how the Tobacco-Free Futures Initiative aligns and supports AHS values and strategies, please refer to Chapter 1 of the Tobacco-Free Futures Guidelines. Once leadership is engaged, the next important step is appointing a site champion who will work with leaders to establish a steering committee to provide vision and lend guidance to implement this initiative. The champion needs to create a vision of a future that connects the decision makers with the goals of the organization. Then the steering committee will make the decisions about the integration of tobacco treatment and support into routine care provided to clients and families at your particular site.
I think as the leader here at Lander, the key point for me to go tobacco-free was we had already had a tobacco cessation program for about 10 years, and we just felt this was a necessary or a natural progression to go more to the next step of being a totally tobacco-free program and provide the clients that opportunity. So that was a big part of the decision. A large part of it had to do with some of our counterparts in AHS, in particular Renfrew Recovery Center, who earlier in the year had decided to go to a tobacco-free programming approach, and the success they were having and the fact that we have a lot of common clients seemed to be a real natural flow for us to support those clients in a seamless way by providing them a tobacco-free programming option here as well.
To make your site roles and responsibilities clear, the TFF guidelines contain a memorandum of understanding for healthcare sites participating in this initiative. The draft steering committee terms of reference can be adapted and adopted for use at your site. We can't stress enough the importance of having leadership engaged and a champion to help steer this initiative.
Do your best to ensure that you have very good support at the site admin level and even at the zone admin level when programs are being implemented at a specific site. It does impact the zone as well, and so you need to make sure that all of the stakeholders, especially at a high level, are supportive of the program and understand the program. As we were getting the steering committee organized, we had a volunteer from cardiology, a physician, step up and volunteer to help us implement tobacco-free futures at the site. He was very instrumental in getting his colleagues, medical directors from the different departments, to continuing education meetings where we talked about tobacco-free futures, we talked about tobacco in a general sense and updated them on current science around tobacco initiatives, and I think that's been very helpful as well.
The steering committee was developed with the idea that we would have representation from all departments. I happen to be the chair of that committee, and everybody has different roles and responsibilities in their jobs here, and with having everybody contribute to that, we got a more holistic view of what was all happening and how could we make this work and what might be some of the barriers and challenges we would face in implementing something such as completely tobacco-free programming and the rest of the Tobacco-Free Futures initiative.
Your steering committee should be representative of your site's services and healthcare professional groups. It's recommended that you recruit from the following groups: senior management, unit management, physicians, nursing, pharmacy, respiratory therapy, workplace health and safety, protective services, patient registration, other examples, clinical education, allied health professionals, community supports, or professionals working with specific populations.
I've benefited from being on the committee because I want to have a voice in the process. Any change that happens in the facility it's going to impact my work. It's going to impact, the staff's work. So if I'm on the steering committee, then I get to have my input into those changes in policy and the things that could impact my day-to-day work. So I think that, just being able to work with my colleagues and trying to understand other people's perspectives so that we could get that big picture. But I certainly like the idea of having a say in that process as well.
For the steering committee, it is a management level committee. However, managements from different areas often don't have the time or the availability to sit there and be the representative themselves. And so what we found here with Allied Health is that myself as a frontline person, I have been able to do that. We wouldn't have otherwise had a representative if we hadn't gone this route. So it has been a really positive experience. I know I have learned a lot.
The TFF guidelines and tools are designed to help support your steering committee. Refer back to them on a regular basis to keep you focused and help you integrate changes at your site.
Excellent resources that are available through Tobacco-Free Futures. So I'm sure you're aware and familiar with the binder that they've produced that has a number of sections, and we in fact covered most of the bases. There was very little that we discovered in terms of implementation that wasn't already included in there.
Let's move on to discuss our province's and AHS's policies on tobacco use. Alberta's Tobacco Reduction Act, which we'll refer to as TRA, protects people from exposure to cigarette smoke by prohibiting smoking within 5 meters or 16 feet of a doorway, open window, or air intake in a public place or workplace, including work vehicles. The AHS policy came into effect on April 1, 2011, and builds upon the protection provided under the TRA by further restricting tobacco use on all AHS grounds and property.
I've chosen to sit on the steering committee because Protection Services has a a role. Since we can enforce the Tobacco Reduction Act through the government, we get fairly good compliance rate within about 15 feet of the doors, as we can write provincial violation tickets. And the violation tickets themselves have some consequences to them.
It is essential that the site leadership and steering committees understand the TRA as well as the AHS policy and their responsibilities to both. Taking the time to review the policy and understanding how your site complies is essential. The Tobacco-Free Futures Initiative and the policy are closely interrelated and mutually supportive of each other.
We wanted to get the tobacco use off the property, but we didn't want to compromise the safety of our clients, right? So that was what, when we got together with the steering committee, we had some discussions about it, and a decision was we kind of came up with the best way in which we can do this is let's just take tobacco right out of the equation, right? Clients are not going to be permitted to leave the property to go use tobacco or any other substance, right? And since that time, it's been encouraging to see how the clients have been willing to adapt to it.
Staff needs to be aware of their responsibility and accountability to the policy in relation to their own as well as patient-client visitor use. For example, there are other rules in place that stipulate that as AHS staff, you can't facilitate clients' tobacco use or purchase tobacco products for them. AHS also offers tobacco cessation assistance for staff. Cessation counseling support for AHS staff is available through www.albertaquits.ca and the Employee and Family Assistance Program, EFAP. For cessation medication coverage, staff can access their employee health benefits. Staff without coverage for cessation medications through their health benefits can access a fund to have 80% of the cost of nicotine replacement therapy reimbursed.
From my own personal response to the Tobacco-Free Futures, years ago when we started this with, I think back in the Calgary Health Region days, I was involved in the tobacco committee from the beginning, and I actually smoked for quite some time up to this point. And part of me quitting for about 4 or 5 years now was this Tobacco-Free Futures and the AHS tobacco reduction policy. I just felt that if I'm to enforce something, how am I to smoke and, possibly where I shouldn't be, that kind of issue.
The guidelines also contain resources, including an assessment tool to determine staff compliance with AHS policy. Alberta Health Services has also established the TFSE Policy Consultation Team to support sites that have questions or challenges related to the TSFE policy.
The policy can create some really passionate discussions at the steering committee table, and it can really dominate a lot of the discussion too. And sometimes steering committees get bogged down at that stage. And really, again, it has to be about understanding how the policy and tobacco-free futures impact each other, how they complement each other, and then just continue to move forward.
For the last part of this module, we are going to talk about timelines, how to set them up and to implement them. The guidelines contain a suggested timeline schedule, which you can adapt for your particular setting for all 4 phases of the TFF implementation model, as well as a baseline assessment tool and implementation plan.
12 to 16 months is a reasonable time frame for a larger facility. Some of the smaller facilities have in the past and probably will continue to be able to roll out in perhaps a more condensed time frame.
The 4-month period that we allowed ourselves to actually implement this was very, very busy, was very aggressive, but everybody on the committee and the other staff were committed to making this happen. So we set a date and went for it, and we made it.
Remember, the guidelines are there to help you and contain many valuable resources and tools to help you implement these changes and work towards a tobacco-free future.
We need the support of all our leaders within the system. We need our physicians involved, all our frontline staff. They need to really be focused on ensuring that we do deal with tobacco use amongst all of our clients, residents, and patients.
The tobacco-free futures provide a toolbox that healthcare professionals can use within their programs and sites to be able to offer the best possible care for their patients with tobacco dependency. And I encourage you to take advantage of that and to become a champion on your unit, within your site, to improve the care of persons with tobacco dependency.
If you are ready, please move on to Module 2, Resource and Support Planning.